Hi, my name is Rainey Brown, and I'm going to talk to you today about meningitis. Meningitis is the inflammation of the protective membranes covering the brain and spinal cord, usually caused by infection. It can be viral, bacteria, or fungal in nature, but also caused by injury, certain drugs, and types of infection. There is a vaccine available for meningitis prevention. The classic symptom triad is going to be headaches, sudden high fever, and stiff neck, which can develop over several hours or in 1 to 2 days. Early treatment of bacterial meningitis is best for a good outcome. So early treatment with antibiotics. Signs in newborn is going to include high fever, constant crying, excessive sleepiness, difficulty waking from sleep, difficulty waking to feed, poor feeding, vomiting, bulging fontanelle, and stiffness in body and neck. You want to seek immediate medical assistance for these signs and symptoms. So bacteria enters the bloodstream and travels to the brain and spinal cord, causing acute bacterial meningitis. This can be from a sinus or ear infection, skull fracture, and sometimes even surgery. Viral meningitis is spread through close contact. Viral meningitis is usually mild and can clear on its own. Viral meningitis is going to be the most common cause of meningitis, followed by bacteria, fungal and parasitic infections. Risk factors are going to include skipping vaccinations, age. So most cases of viral meningitis occur in children younger than 5, and most cases of bacterial younger than age 20. Close living settings, so college dorms, military bases, boarding schools, daycares. This is because the bacterium is spread through the respiratory route. In pregnancy, your risk goes up for listeriosis, which can cause meningitis. And it puts you at risk for miscarriage, stillbirth, premature delivery, and a compromised immune system, such as with AIDS, alcoholism, diabetes, and the use of immunosuppressant drugs can increase your risk for meningitis. Bacterial meningitis, the most common causes are going to be your streptococcus and your Neisseria. So your physical exam, the general appearance of the patient, these patients are going to look distressed. Are they altered? Are they oriented to person, place, time, or situation? For vital signs, are they febrile? That's one of the classic symptoms. Bradycardia can indicate increased intracranial pressure. Do they have a headache? Do they have neck stiffness? Positive Brzezinski's and Koenig sign may be suggestive of meningitis. So bacterial meningitis has to be considered when patients come in with headache, stiffness, neck stiffness, and fever, and altered mental status. A lumbar puncture is needed to get some cerebrospinal fluid, so you can do a culture. This is the cornerstone of diagnosis. For meningitis, a CT scan can show swelling and inflammation of the brain. Blood cultures help identify the causative bacterial agent. A CBC will demonstrate polymorphonuclear leukocytosis, and a CMP can indicate dehydration. So treatment, early antibiotics is important with bacterial meningitis for a good outcome. So you got to find out the causative agent so you can treat correctly. Viral meningitis, you want to treat with rest fluids and over-the-counter medications for fever and body aches. Severe complications can be hearing loss, memory difficulty, learning disability, brain damage, gait problem, seizure, kidney failure, shock, and even death. With prompt treatment, even severe cases have a good outcome. The meningitis vaccination is offered for children between the ages of 1 to 12 and a booster shot at age 16. Teach patients good hand hygiene, good hygiene in general. Don't share food, drink, straws, eating utensils, or toothbrushes. Keep your immune system healthy by getting plenty of rest, exercising regularly, and eating a well-balanced diet. Cover your mouth when you sneeze and cough. If you're pregnant, make sure you're cooking those deli meats. Avoid unpasteurized food. If you've been hospitalized, make sure you're conserving your energy and get plenty of rest. Eat clean, safe, healthy foods. Practice good hand hygiene. And I hope you have learned a little bit. Bye-bye.